We're now 14 days out, if you didn't know, since the time they put that real restriction in. So that first 14-day period is over. But that doesn't mean we can be complacent. What's the next days? How do we look at that? And I'm trying to encourage on that. We're trying to look at some aspects around people are still returning from the Hubei province, because there's the Hubei province and there's the wider Hubei province. And the area is a big concern that. It's a big area. It's much like in SARS. People thought that Toronto was Ontario and they're one and the same. And the answer is that's not true. It's a bigger area. So we're trying to understand that and what we might ask those people who are continually coming from the Hubei province in the next, within 14 days, what we might ask them to do. We have people on investigation. We have people of, I call it, I'm trying of the right term, of interest or clinical significance that healthcare professionals, for reasons, would like to have the novel coronavirus tested because there's something about that that concerns them and maybe relate to that. So we can't say, no, we're not going to do it if that's something you feel is necessary. And we're getting more and more of those as part of the rendering or pending tests. So how do we ensure ongoing, because of their proximity to the area of concern in Hubei, they may not have had the same impact that the centers did. Nevertheless, they may have had more potential for inadvertent contact, and we want to be sensitive to that. And how do we handle that in the right way, the most sensitive way, and respecting that these individuals who are coming into Canada would only want what's the best for them, for their family, and for Canada at large.